Let me ask you a question. You've heard about turmeric. You've seen the headlines. You've probably even tried it. But what if I told you there's another spice sitting in millions of kitchens right now that scientists have been quietly studying for over 40 years, and the results around cardiovascular health are, frankly, remarkable. A spice that has been shown in peer-reviewed clinical research to help reduce LDL cholesterol, lower triglycerides, decrease blood pressure, and, crucially, target something called arterial plaque buildup. The kind that quietly narrows your arteries for years before you even feel anything. That spice is garlic. Specifically, aged garlic extract, a highly concentrated, clinically studied form that is very different from what you cook with. Now, I know what you're thinking. Garlic? That's not forgotten at all. But here's the thing. Most people have no idea about the science behind it. The specific compounds, the dosing that actually works, and the clinical trials showing its effect on arterial plaque. Most people are still thinking of garlic as just a flavoring. Today we're going to change that. Stay with me, because if you're over 50, over 60, or you're watching out for someone you love, what you're about to learn could genuinely matter. Before we talk about the solution, let's understand the problem and why it matters so much for people in their 50s, 60s, 70s, and beyond. What is arterial plaque? Arterial plaque, medically called atherosclerosis, is a buildup of fats, cholesterol, calcium, and other substances along the inner walls of your arteries. Think of it like a slow narrowing of your pipes over time. Here's the concerning part. It builds up silently. You can have significant plaque accumulation for decades without a single symptom. The first sign for many people is a heart attack or stroke. According to the American Heart Association, heart disease remains the leading cause of death in the United States, responsible for approximately 1 in every 5 deaths. And atherosclerosis is the underlying condition driving the vast majority of those heart attacks and strokes. Several factors contribute to plaque development, many of which accelerate after age 50. High LDL cholesterol, particularly oxidized LDL, is a key driver. Oxidized LDL particles embed in artery walls and trigger a damaging inflammatory response. Chronic low-grade inflammation damages the inner lining of arteries, called the endothelium, making it easier for plaques to form and harden. Elevated blood pressure mechanically stresses arterial walls over time, accelerating damage. High triglycerides compound the risk, particularly when combined with low HDL, good cholesterol. Oxidative stress, an imbalance between free radicals and the body's antioxidant defenses, accelerates every stage of plaque formation and progression. Now here's what makes this conversation about garlic so compelling. Research shows that aged garlic extract addresses multiple of these mechanisms simultaneously, not just one. And that is genuinely rare in the nutritional science literature. But what makes aged garlic extract different? When most people think of garlic and health, they think of allicin, the sulfur compound released when you crush a raw garlic clove. That's the one most associated with garlic's pungent smell and immediate medicinal reputation. But here's the critical distinction. Aged garlic extract, abbreviated AGE, is not raw garlic. It is produced through a specific aging process, typically 20 months or more, during which raw garlic is stored in ethanol at room temperature. During this aging process, harsh, unstable compounds like allicin are converted into a unique set of stable, highly bioavailable, and potent organosulfur compounds. The most studied of these include S-allyl-cysteine, or SAC, the primary bioactive compound in aged garlic extract and the most extensively researched. SAC is water-soluble, highly absorbable, and demonstrates antioxidant, anti-inflammatory, and cardioprotective properties in numerous peer-reviewed studies. S-allylmercaptocystine, or SAMC, another stable organosulfur compound with documented antioxidant properties. Allicin, a non-sulfur compound with potent antioxidant and neuroprotective effects. Fructosyl arginine, an age-specific compound found only in aged preparations, with its own antioxidant activity. Unlike raw garlic, age is odorless, well tolerated by the digestive system, and standardized, meaning the dose you take is consistent and measurable. This is critically important for therapeutic use. This is precisely why virtually all the major cardiovascular clinical trials use aged garlic extract specifically. Not raw garlic powder, not garlic oil, not garlic capsules from the grocery store. The most widely studied commercial age product in cardiovascular clinical research is Kyolic Aged Garlic Extract, produced by Wakanaga of America. Multiple randomized controlled trials, the gold standard in clinical medicine, have used this standardized extract, which is why the science behind age is as robust and repeatable as it is. Now let's talk about what the research actually shows. And I want to be crystal clear. We are talking about peer-reviewed, published, randomized controlled clinical trials, not anecdotes, not animal studies alone, human clinical trials. One of the most compelling areas of research involves a measurement called coronary artery calcium score, or CAC score. This is a CT scan-based measurement that directly quantifies how much calcified plaque exists in the coronary arteries. It is one of the most reliable and accepted markers for cardiovascular disease risk in modern medicine. A landmark randomized, double-blind, placebo-controlled study published in the Journal of Nutrition in 2016 by Dr. Matthew Buildup and colleagues at the UCLA School of Medicine enrolled 55 patients with metabolic syndrome who were already receiving statin therapy. Participants received either 2,400 nmol of Kyolic aged garlic extract or a placebo daily for 1 full year. The results were striking. The age group showed a statistically significant slowing in the progression of total coronary artery calcium, a direct measure of plaque calcification compared to placebo. The age group demonstrated significant reductions in low attenuation plaque, soft, non-calcified plaque, which is considered the most dangerous type because it is most prone to rupture and cause acute heart attacks. Dense calcified plaque volume and total plaque volume were similarly slowed in the treatment group. This was a significant finding. The ability of age to specifically reduce soft, vulnerable plaque, the type most associated with acute myocardial infarction, is of profound clinical interest. An earlier study by the same UCLA research team, published in Preventive Medicine in 2004, similarly demonstrated that aged garlic extract significantly slowed the rate of coronary calcium progression compared to placebo over a 12-month period. Multiple meta-analyses and systematic reviews have examined garlic's effect on lipid profiles. A comprehensive meta-analysis reviewing 26 randomized controlled trials, published in the Journal of Nutrition in 2012, found that garlic supplementation, particularly age, produced significant reductions in total cholesterol and LDL cholesterol. A separate randomized controlled trial published in Experimental and Therapeutic Medicine in 2016 found that aged garlic extract produced a statistically significant reduction in both LDL cholesterol and triglycerides, with a corresponding improvement in the LDL to HDL ratio, a critical composite cardiovascular risk marker. The mechanism? S-allylcysteine, the primary compound in age, inhibits an enzyme called HMG-CoA reductase. This is, notably, the same enzyme targeted by statin medications. Additionally, SAC reduces lipid oxidation, meaning less oxidized LDL is available to initiate the inflammatory cascade that begins arterial plaque formation. Hypertension, high blood pressure, is one of the most powerful modifiable risk factors for arterial plaque progression and cardiovascular events. Multiple trials have examined age's antihypertensive effects. A 2016 meta-analysis published in the Journal of Nutrition, reviewing 20 randomized controlled trials, found that garlic supplements, particularly age, produced clinically meaningful reductions in systolic blood pressure, averaging approximately 9 mmHg of mercury, and diastolic blood pressure by approximately 7 mmHg of mercury in participants with elevated blood pressure. To contextualize those numbers, data published in the British Medical Journal indicates that a reduction of just 5 mmHg in systolic blood pressure is associated with a roughly 14% reduction in the risk of stroke and a 9% reduction in the risk of coronary heart disease. Age's observed effects in trials exceed that threshold substantially. The mechanism involves Age's stimulation of nitric oxide synthase, which produces nitric oxide, a signaling molecule that causes blood vessel walls to relax and dilate, reducing vascular resistance and thereby blood pressure. Chronic low-grade inflammation is the biochemical engine that drives arterial plaque development and destabilizes existing plaques, making them vulnerable to rupture. Age has been shown in multiple studies to reduce key inflammatory biomarkers, including C-reactive protein, or CRP, and interleukin-6. A 2018 study published in the journal Nutrients demonstrated that age supplementation significantly reduced CRP, a primary blood marker of systemic inflammation, in subjects with elevated cardiovascular risk profiles. SAC's direct antioxidant activity also reduces LDL oxidation. Since oxidized LDL is one of the primary initiating events in atherosclerosis, reducing oxidation at this step has theoretical and measurable downstream benefits on plaque development. Now, and I want to be very direct here, aged garlic extract is not without important considerations, especially for seniors. Garlic has mild antiplatelet and mild anticoagulant properties, meaning it can slightly reduce the blood's tendency to clot. This is part of why it's considered cardioprotective. But it also means there are real situations where you must exercise caution. If you take blood-thinning medications, including warfarin, clopidogrel, Plavix, or daily aspirin therapy, you must speak with your doctor before adding any garlic supplement. The combination can increase bleeding risk. If you are scheduled for surgery, dental procedures, or any invasive medical procedure, stop age supplementation at least 2 weeks prior and inform your healthcare provider. People with low blood pressure should use caution, as age can further lower blood pressure and may cause dizziness or lightheadedness. Age may interact with certain HIV medications and some other drugs metabolized by the liver. Always disclose all supplements to your physician and pharmacist. That said, in clinical trials at standard doses, aged garlic extract has demonstrated an excellent safety profile. It is generally well tolerated, does not cause the gastrointestinal irritation associated with raw garlic, is odorless, and participants in long-term trials have not shown concerning side effect patterns. The standard dose used in most cardiovascular clinical trials is between 1,200 milliliters and 2,400 milliliters per day of standardized aged garlic extract. Always look for a product standardized for SAC content on the label. This tells you the active compound is verified and present at therapeutic levels. But please, do not start any new supplement regimen without first discussing it with your doctor or cardiologist, especially if you have an existing heart condition, take medications, or have had cardiovascular events in the past. A supplement is not a prescription, and your doctor's individualized guidance is irreplaceable. One final thing I want to be transparent about. No single supplement reverses decades of arterial plaque on its own. The research is clear that aged garlic extract produces its best results as part of a broader, comprehensive cardiovascular strategy, what the evidence strongly supports combining with age. A Mediterranean-style or DASH diet, emphasizing fiber, vegetables, legumes, olive oil, nuts, and fatty fish while limiting processed foods and excess sodium. Regular moderate aerobic exercise, even 30 minutes of brisk walking 5 days a week has documented measurable effects on blood pressure, lipids, and arterial health. Not smoking. Smoking dramatically accelerates atherosclerosis by directly damaging the endothelium and increasing oxidative stress. Managing blood sugar. Insulin resistance and type 2 diabetes are major independent drivers of cardiovascular damage and plaque progression. Adequate restorative sleep. Chronic poor sleep elevates inflammatory markers, including CRP and IL-6. Think of aged garlic extract as one well-researched, evidence-based tool in a well-stocked toolbox, not the entire toolbox. Combined with the right lifestyle, the evidence for its cardiovascular benefit becomes substantially stronger. So let's bring this together. Aged garlic extract, a standardized, odorless, clinically studied form of garlic, has been shown in peer-reviewed randomized controlled human trials to slow the progression of arterial plaque, including the dangerous soft plaque most associated with acute heart attacks, Reduce LDL cholesterol and triglycerides through mechanisms that overlap with how statins work. Lower blood pressure in people with hypertension, with reductions clinically associated with meaningful reductions in stroke and heart disease risk. Reduce systemic inflammation and oxidative stress, two of the root biochemical drivers of cardiovascular disease. It is not a miracle. It is not a replacement for your doctor's advice or your prescribed medications, but it is one of the most extensively studied natural compounds in cardiovascular health research, with a safety profile that makes it a very reasonable, very legitimate conversation to have with your physician. You're here. You're watching. You're asking questions. That already puts you ahead. The goal isn't to be perfect. It's to give your heart and your arteries the best possible support every single day. If this video gave you something useful, please share it with someone who needs it. And hit that subscribe button, because every week we bring you science-based, honest, senior-friendly health information. No hype, no fear, just facts. Take care of yourself, and I'll see you in the next one.